This video will be split up into two main topics: vehicles and excipients. First, we're going to talk about the different types of solvents and vehicles we can use to formulate injections, and then we'll talk about the different kinds of excipients we can incorporate into parenteral products. Beginning with vehicles, the first type is water for injection. There are two types of water for injection: sterile and non-sterile. And we can already establish that water for injection doesn't always need to be sterile. It just needs to be pure enough so that it can be used in the formulation of injections. Let's start with non-sterile water for injection, because that's what we normally mean when we say water for injection without specifying the type. Non-sterile water for injections are the most commonly used solvents in large-scale manufacturing. In the manufacturing process, we would prepare the parenteral product first, then we would add the water for injection, which acts as a solvent or diluent for the substances that make up the injection to form the final product. Okay, so you might be wondering that we are preparing this parenteral product, which is non-sterile, even though in the introduction video we established that all parenterals must be sterile. Are we just contradicting ourselves at this point? No, because the last step will be to sterilize the final product so that it can be administered into or by the patient. So overall, we prepare the parenteral product first by dissolving all the components that need to be dissolved, and then we sterilize it. So we talked about how we can prepare a parenteral product using water for injection. But how do we prepare the water for injection itself? Well, it is obtained and prepared from potable or purified water, and the water can be purified by either distillation, ion exchange, or reverse osmosis. Although water for injection can be non-sterile, it must be pyrogen-free. That is, it must be free from any substances that cause fever. When we come to package water for injections, we do so in glass or glass-lined, tightly closed containers, and we store them under temperatures at which microbial growth does not occur. Sterile water for injections. They are used as solvents and diluents to prepare sterile parenteral products without the need for further sterilization at the end, meaning that once the active constituents are dissolved in the water, the final product is formed and the injection can be used immediately. To the water itself, no antimicrobial agents or other substances are added. Both non-sterile and sterile water for injections must be pyrogen-free, and sterile water for injections have the additional requirement of being sterile. They are packaged into single-dose containers not larger than 1 liter, and they are used for the reconstitution of several antibiotics such as sterile ampicillin sodium. To reinforce what we just mentioned, here is a label of sterile water for injection. As we can see, it is packaged into single-dose vials. No antimicrobial or other substances have been added, and they are sterile and non-pyrogenic. And if we take a look at the label for sterile ampicillin injection, we can see that sterile water for injection was added onto it for its reconstitution. Bacteriostatic water for injection. This is basically a combination of sterile water for injection and at least one antimicrobial agent. And consequently, the requirement here is that it must contain antimicrobial agents. They are packaged into pre-filled syringes or in multiple dose vials not larger than 30 milliliters. On the container and on the label on the container, the name and the quantity of the antimicrobial agents incorporated must be mentioned. And also this very important sentence: not for use in neonates. And this brings us to a very important point to take care of. The most common antimicrobial agent used to formulate bacteriostatic water for injections is benzyl alcohol. Injections preserved with benzyl alcohol can never, ever, ever be administered into newborn babies, as it can lead to their death. Why? Because if administered into newborn babies, benzyl alcohol causes a condition called gasping syndrome. This is when benzyl alcohol is not fully and efficiently metabolized by the newborn's liver, as it has not fully developed yet. So instead, benzyl alcohol accumulates and causes metabolic acidosis, gasping, seizures, and death. This is not a problem in adults, as the liver is mature and is effectively able to detoxify and metabolize benzyl alcohol, and hence administration of benzyl alcohol is safe for adults. The problem lies, though, in newborns, so it is prohibited to be given to them at all costs. And even on the label, as we can see again in capital and in red, it says not for use in neonates, and of course the name and the concentration of the antimicrobial agent that was used. Sodium chloride injection. It is a sterile isotonic solution of sodium chloride in water for injection, and the concentration of sodium chloride is 0.9%. We use them to reconstitute medications for injections and to clear catheters and IV lines, as presented in this diagram, to prevent their obstruction. No antimicrobial agents are added to them, and hence they are safe for use by children. The requirement here is that they must be sterile, and they are packaged into single-dose containers, as again we can see from this diagram. Bacteriostatic sodium chloride injection. They are sterile isotonic solutions of sodium chloride in water for injection, with the addition of antimicrobial agents, at least one, and hence again the requirement is that it must contain antimicrobial agents. They are packaged into multiple dose containers not larger than 30 milliliters, and again they are not administered into newborns because of benzyl alcohol poisoning. Ringer's injection. It is a sterile solution containing 3 salts, sodium chloride, potassium chloride, and calcium chloride, in water for injection, and it is administered intravenously. We use it as a vehicle for medications, but mainly as an electrolyte replenisher and as a plasma volume expander. Lactated Ringer's injection is exactly the same thing as Ringer's injection, meaning that it contains the exact same 3 salts, but with the addition of sodium lactate. And if you look at this diagram, we can see exactly that. Look, the 3 same salts and sodium lactate. This injection can be used as a systemic alkalizer to treat metabolic acidosis via the buffering action of bicarbonate. Bicarbonate is obtained from the metabolism of lactate in the liver. Now that we've finished talking about aqueous vehicles, let's talk about non-aqueous vehicles. They are used for water-insoluble drugs or drugs which are susceptible to hydrolysis. And there are certain properties of non-aqueous vehicles that are very important to consider and to fulfill. Non-aqueous vehicles must be non-irritating, non-toxic, and non-sensitizing. They must have no pharmacological activity, and they must have no interaction with any of the components in our injection. They must be miscible with physiological body fluids. They must be physically and chemically stable at various pH. They must be viscous enough or easily removed or injected or administered. The viscosity should not be too low so that it's not too fluid, but at the same time it should not be too thick so that it can easily be administered. And as we said, it should be fluid at over a wide range of temperatures and cannot solidify during the winter. It must be made accessible at all times. Non-aqueous vehicles must have high boiling points to allow for heat sterilization without breaking down. And examples of non-aqueous vehicles are glycerine, alcohols, and fixed vegetable oils. Now, according to the US Pharmacopoeia, excipients can be added provided that they are harmless in the amounts administered and that they don't interfere with the injection's therapeutic effect. We add excipients to prevent, minimize, or delay the degradation of parenteral products, and in doing so, we can increase the product's shelf life. We add excipients to adjust the product's pH and tonicity if our aim is to reduce pain and irritation upon administering the injection. So what kinds of excipients are we talking about exactly? Well, we can add antimicrobial preservatives, antioxidants, buffers, and tonicity adjustment agents. Let's begin with antimicrobial preservatives. They are added to injections intended for multiple use to prevent microbial growth. If the injection is formulated with benzyl alcohol preservative, it cannot be administered to newborn babies. As previously established, they cannot be used in large amounts due to their toxic and irritating properties, and as such, they should never be added to intraspinal and intraocular injections. If the drug substance is prone to degradation by oxidation, we can use antioxidants such as vitamin C and vitamin E. However, it is common practice to use pharmaceutical-grade compressed nitrogen gas to displace the oxygen dissolved in the drug solution. By displacing and removing the oxygen from the solution, we reduce the chances of the drug entering a chemical reaction with oxygen and being oxidized, and therefore, we can enhance both the stability and the shelf life of the drug. Buffers. When we come to formulate any injection, because it will be administered into the physiological fluid of the human body, it needs to ideally have the same pH as physiological fluid, which is 7.4, so that no complications occur. Therefore, we can theoretically establish that all injections should have a pH of 7.4. However, when we talk practically about this, we need to consider other factors. What if the drug is stable at another pH? What if it's soluble at another pH? These factors are important as well. They can't just be ignored. So practically, the actual pH of parenteral products ends up being a compromise of the optimum pH for stability, solubility, and physiological compatibility. The ideal pH can range from between 3 to 10.5. Below pH 3, the patient would experience pain at the site of injection, and above pH 9, tissue necrosis would occur. That is why it is imperative that the pH of parenteral products be maintained within this range. For us to maintain the pH, we need to know what factors change it. The pH of many compounds is prone to change when we sterilize the preparation using heat, when the medicament is broken down, and by the interaction of a certain substance in the preparation with the container. In these cases, it is essential that we introduce a buffer to maintain the pH. The choice for which buffer is most suitable to use for each parenteral product depends on the optimum and desired pH of the product itself. If we want the pH to be more on the acidic side, then we can use citrate and acetate buffers. Citrate buffers working best at the pH range 2 to 6, and acetate buffers between 4 and 6. If we want the pH to be more on the basic side, we can use phosphate buffers, which work best at the pH range 6 to 8. And if we want a buffer which can be used under acidic and basic conditions, we can use glutamate buffers, with an acidic pH range of 2 to 5 and a basic pH range of 8.5 to 10.5. Finally, tonicity adjustment agents. We know that if we were to introduce a hypotonic solution into the bloodstream, our blood cells would swell and burst. And likewise, if we were to introduce a hypertonic solution into the bloodstream, the blood cells would lose water by osmosis and shrink. Either way, this is undesirable, and as such, injection solutions should be adjusted to approximately the same osmotic pressure as that of physiological fluid. Hypotonic solutions are made isotonic by adding sodium chloride, dextrose, or mannitol, while hypertonic solutions are made isotonic by dilution before they are administered. And now that we've finished vehicles and excipients for injections, that will be all for this video.